Doctor, English please. Hi, I'm Dr. Isabel Rambob, a general dentist originally from Brazil, and I have been living in Maryland, United States for over 20 years. I have been teaching at the University of Maryland School of Dentistry since 2009. Currently, I'm in the Department of Neuroimplantment Sciences, where I'm the course director of behavioral dentistry. I'm also an entrepreneur. I own Rambob Training Services, a company that provides soft skills training and coaching to healthcare professionals. Dentistry is an amazing career, and from my 20 years experience as a practicing dentist, I can share some of the pros and cons of the profession. As a pros, I would say the ability to connect with people and improve their lives, the ability to improve the patient's oral health, which will impact to their overall health, the ability to build a committed team that will provide the best care to our patients, and the excitement of always learning something new. As a con, I would say dentistry can be very taxing on one's physical, mental, and emotional health. So it's very important to have a self-care routine to help you to balance your work life and also to give you the ability to provide the best care to patients. I have had incredible experience with patients, but I'd like to highlight two patients in particular. Let's start with Mrs. K. Mrs. K is a military veteran with a history of PTSD. The first time I encountered Mrs. K, she was very anxious and she alerted me, I need sedation. So after my examination, we elaborated a treatment plan for Mrs. K. And from the procedure standpoint, her treatment plan wasn't that complex. So basically, she was a perio patient who required 4 quadrants of skin replanning. Because of the rapport we established at the beginning of our session, our first encounter, I decided to do the skin replanning myself instead of referring Mrs. K to our dental hygiene team. Asked Ms. K to give a try and start our treatment, our first round of skin replanning without sedation, just with some behavioral management techniques to ease her anxiety, and she agreed with me. We were able to complete her entire treatment using only local anesthesia, and she shared with me that for the first time in her life, she was looking forward to seeing her dentist. Taking the time to really understand your patient's fears, desires, and expectations can go a long way. So let's talk about the second patient experience, and is about Mrs. N. Mrs. N is a domestic violence survivor, and she participates in a program in the University of Maryland School of Dentistry where we provide free dental care to female victims of domestic violence. I have been running this program since 2010, and it's so rewarding receiving the feedback of the patients who have completed treatment and how the dental treatment was able to help them to rebuild their self-esteem and the self-love. But going back to Mrs. N, she, as I mentioned earlier, she's a domestic violence survivor with a very complex medical history. She had all the reasons to be a bitter person, a complainer, but she was one of the most positive, kind, generous, and grateful people I have met. She's such an inspiration, and despite of all her struggles, the challenges she has encountered in her life, she still keeps a unbeatable spirit and a joyful heart. I'd like to share some tips with young dentists and also with people who might be considering dentistry as a career. First of all, be humble. Be open to learn from your team, your colleagues, and patients. Be a good listener. Create an environment where people feel comfortable to give you feedback. Be careful with your body language and how it impacts your relationship with your patients. Be mindful of the selection of words you use to communicate with patients. Words generate emotions. And understand the patient's journey as they seek care. And try to give this patient the best experience every single touch point. From your website, your social media presence, how your front desk personnel answers the phone, how this patient is greeted when they arrive to your clinic, and so forth. Don't miss opportunity to wow your patient, so they'll be referring you to the family and friends. You should never say to your patient, there is nothing I can do for you. There is always something we can do for our patients. And it might involve referring this patient to another provider, give your best advice, and have a candid conversation in a very professional and empathetic manner that your practice might not be the best place for this patient, and you offer options where they could seek care. When you are treating patients, you should avoid being condescending, biased, and making assumptions about patients' desires and expectations. Don't assume that your definition of successful dental treatment automatically will mean success from the patient's perspective. As dentists, we should aim to avoid using dental terminology when you communicate with patients. But here and there, it might happen. In my case specifically, because I'm a dental educator and I'm in an educational setting, I'll be sort of mention some dental terminology here and there as students as we discuss the case together. But we warn the patient that we explain everything to them in lay terms. So it's very important to, if you have a conversation with your team, that you tell your patient, later on we have this discussion, we have to really use this terminology, but when I will explain things to you, I'll explain in a manner that will be easier for you to understand. And when you use dental terminology with patients, typically the reaction that I get is, "Doctor, English please." I believe one of the dentist's challenges with patients is to clearly communicate the value of the dental treatment, to change the perception that dental treatment is so expensive. We have to better communicate the benefits of achieving and maintaining good oral health that resonate with the patient's own definitions of being healthy. Dentistry is definitely a worthwhile career. I'm so excited with the endless possibilities ahead of us and the technological transformations in our field. I believe technology is not a barrier, but is an aid to expedite processes so we can spend more quality of time with our patients. I'm Dr. Isabel Rambob, a dental hero from Baltimore, Maryland. Check out the link to my website in the description below, and don't forget to subscribe to the YouTube channel.